I work for DISC, Drop-In and Share Centre, and we're based in Camborne, and we are open 5 days a week to vulnerable adults over the age of 18, and predominantly at the moment we support people with learning difficulties, mental health problems, homeless people, people with drug and alcohol addictions, and ex-offenders.
We're trying to support the most vulnerable in society, and there are a number of different groups, categories that you could put people into, but generally human beings who found themselves excluded from society, probably because of their behaviour, but they still need somebody to work with and support them with. Others who've experienced significant abuse and trauma in their lives, and a number with significant mental health issues.
I just get to talk to people here, and it's a lot of help because the stuff that I've not been able to tell anyone else, I've been able to tell the staff here, and it's really good. I feel a lot lighter through some of the stuff I've told them, and it's all better now, you know, I'm on the right track now.
Through this project, I mean, I've had help with the British Legion, I've had lots of help, counselling, where to find, where to go, what to do, because some people just don't really know what to do.
Yeah, they weren't using it.
Where from? Local.
It's like we're the people who don't matter. Even though a lot of us are actually, like myself, I'm a disabled land worker. I've worked on the land most of my life, providing food for this country, flowers, Christmas trees, hops, beer, all that stuff. But we still don't seem to matter, you know what I mean? I'd like whoever is hearing this, whichever member of Parliament, to recognise the fact that these places are very useful to people who are down on their luck and need a helping hand up, really. Yeah.
As someone who's delivering services, what is your view of the government's plan for a big society?
I think it's absolutely ridiculous, personally. I think their morals are completely wrong. I just think they need to open their eyes. I personally think that the government needs to come into the real world. I think they need to come to the streets. I think they need to see for their own eyes what's going on. It's right sitting in an office with your suited and booted and everything else and making decisions that they don't know nothing about. They seem to think they do because they read it from textbooks and whatever else, but come to the real world, then make your cuts. But I think it's totally wrong. I think they're making a really, really bad decision because they're just going to encourage crime rate is just going to go soaring through the roof. It really is, and they're breeding things that doesn't need to be bred. So yeah, come into the real world.
The biggest problem with the government's plan for a big society is whenever you ask people to describe the big society, nobody really can. Where you've got vision and leadership, you expect somebody to paint a picture of the future, of the direction we're going in. And we have not yet had that from the government.
I like the idea of a big society, but I actually thought I already lived in one. I don't think anything in their thinking is new or original. It's the way so much is done now, and I think there are countless number, for example, of volunteers running projects that just don't get heard.
I think they should be looking into funding more for the voluntary sector because society wouldn't run without the volunteers, you know, and that is a fact, you know, and they need some help from somewhere.
So this video will be seen by the people in the government, people who make decisions about policy and about funding. What would your message be to them?
Basically, they need to realise that us young people have just got nowhere to go, and that they've got it all good. They've got places to go to, they've got money coming in, whereas us lot don't. And that'd be my message to them.
come into the real world. Come into the real world. Come and spend a couple of days here. Come and spend a couple of days on the streets. See how these guys live. Do you know what I mean? Then, like I said earlier, then make your cuts.
Well, get their head out of their books and out of the soil and come and visit themselves and see what's going on. Then they will understand that the decisions they have made are totally wrong, and they need to look at everything and provide the support for agencies and the funding for them.
I think what the government needs to look at is the impact that all these cuts actually have on people's daily lives. People who will turn to drink, people who will turn to drugs, and people whose mental health is going to be affected hugely by these cuts. And services like ours, and sadly huge numbers of the services which we see daily having their funding cut. I don't know what the government's thinking, to be honest. I agree there needed to be cuts. However, I think the biggest mistake of all is where those cuts have been made.
I'll give you some direct examples. Some of the groups that we were working with at the end of March, and it's nearly the end of March now, will no longer exist because of the tipping point. Once you take away about 40% of an agency's funding, it literally cannot survive. Other agencies in Cornwall, such as Shelter and the YMCA, have cut their staff by a third because the local council has decided to cut supporting people by 40%. It was given the option to spread that cut over a period of time, but chose to front load it, which was a huge mistake. The cuts are coming too fast and too quickly, and it depends on who you talk to. But when you actually get down to the nuts and bolts of it and talk to individual police officers and neighbourhood beat managers and workers within adult social care, many of them are very, very concerned about what we will be left with. Because there is no, as I said, with the big society, needing a picture, a vision, paint it for me, and nobody can. Can anyone paint the picture for us of what the police service will look like with the cuts, or what adult social care should look like with the cuts? Nobody can. Here are the cuts, and then you need to get on with, well, whatever you're meant to get on with. But how can you, with 2/3 of the people you're left with, doing increasing workloads because the need of the population increases, because you've taken away the very support mechanisms that were keeping a number of the most vulnerable going? My biggest fear is that there are going to be areas of the country where safeguarding will just get missed, and vulnerable people will find themselves going from moderate need to severe.